Shoulder pain affects a variety of populations, from fitness athletes to corporate workers. And today I'd like to talk about shoulder impingement, sometimes also known as subacromial impingement of that shoulder. So we're going to walk through what that is and some factors that are contributing to it so that we can work around it, work through it, and improve your work postures as well as your workouts. Hi, I'm Dr. Zach Ratliff at TruMotion Therapy here in Charlotte, North Carolina. We specialize in the conservative management of musculoskeletal pain and injuries, meaning that our treatments don't involve the use of drugs, surgical interventions, or long-term care plans. To understand shoulder impingement, let's talk about kind of the players involved in this area. So we want to think about how that shoulder blade or scapula interacts with the rib cage. We want to think about how that scapula attaches to the clavicle in the front. And then we want to think about the ball and socket of the shoulder itself. So all of these are contributors to shoulder impingement. So when we think about the shoulder, it operates on pretty tight margins. Certain things need to move over one another in kind of a proper sequence. And when that sequence gets a little bit out of whack, it can cause a irritation or a compression impingement. So specifically the structure that's getting impinged is typically this supraspinatus tendon. So this is one of your rotator cuff muscles, and you can see it goes under this hook called the acromion. So that's a little hook coming off of the shoulder blade, and this tendon is going right underneath it. Now, when our shoulder positioning might be a little bit more rounded forward or our mid back is a little bit slouched, it's going to tighten those margins that we talked about in the shoulder. And so with certain movements, particularly overhead or reaching across the body, sometimes this tendon gets pinched underneath of that kind of bony hook. And this can cause inflammation. It can actually cause some injury to that rotator cuff tendon, as well as just pain. So now that we understand some of the mechanics that are contributing to that shoulder impingement, let's chat about some of the factors that we can mediate to get a little bit more real estate in that shoulder and decrease some irritation. So one of the big factors is going to be that rib cage and mid back. So when we're rounded forward, it's going to push those shoulders forward. So one of the things we want to work on is thoracic or mid back extension. The taller we can get that spine, the better position that shoulder is going to be in. The other interaction is that shoulder blade itself. So for most of us, that shoulder blade kind of starts to drift out toward the shoulder. We want to think about those shoulder blades being able to sit in your back pockets, and that's called scapular retraction. So it's a very stable position for that shoulder blade, and that's the main job of the shoulder blade, is the stability, so that we can think about the ball and socket out here as kind of the mobility aspect. So shoulder blade and thoracic extension are going to be important, as well as kind of that starting position of the ball and socket of the shoulder itself. For a lot of us, it tends to kind of sit a little bit forward. And so we want to think, as those shoulder blades are going into our back pockets, the shoulder itself is also opening up in the front. So that might be loosening up the pecs in the front, or even just correcting a starting position for your work postures or certain movements in the gym. Now, every case of shoulder pain can be a little bit different, and everybody has slightly different triggers or movements that might be bothering their shoulder in particular. So I would advise finding a provider that is familiar with these kind of sports injuries, and then they can help you with a plan to get you back to doing the things you love. If you are near the Charlotte area, I would invite you to check out our website at TruMotionTherapy.com, so you have more access to information, resources, as well as the ability to schedule an appointment with one of our providers. And we would love to get you out of pain and back to your full function, whatever that looks like specifically for you. As a add-on, there will be a part 2 to this video walking through some tips on certain movements in the gym that I commonly see shoulder impingement occur. So be on the lookout for that as well.